India has logged 3,016 new COVID cases in the last 24 hours itself, a jump of 40% in daily cases, according to the Union Health Ministry. The number of active cases has increased to over 13,500, which is the highest case count seen in almost 6 months. In the past 24 hours, a total of 14 new deaths were also recorded in the country, including 8 from Kerala, 3 from Maharashtra, 2 from Delhi, and 1 from Himachal Pradesh. The maximum cases of COVID-19 have been reported in Maharashtra with 483 new cases, followed by Kerala, which has recorded 686 cases, and Delhi with 300 new COVID-19 cases. Meanwhile, Karnataka and Kerala both have logged 215 and 112 COVID cases respectively.
Well, Delhi has seen increase in number of COVID cases, and that is something that has been a development of concerning nature. The Delhi authorities will be holding talks and meetings later today regarding the development. And it's just not Delhi, but Mumbai has also seen a certain level of increase in number of cases. We know that Delhi saw cases up to 300 just on Wednesday. This is something that raises the alarm bell. Last time such numbers were noticed were in September of last year. The Indian Prime Minister has also been holding meeting on the COVID crisis, and we know that in the past the Indian government has been dealing with the challenge. But one thing is for sure, the message from the authorities has been that it's not time to let up, and make sure that when it comes to coming to crowded places, people should wear masks. So, answerable for WION in New Delhi.
Been reported from the southern Indian state of Tamil Nadu. This takes the total tally of active cases to close to 700. We have to keep in mind that the testing rate on a daily basis is close to 3,000 tests, so the numbers actually could be slightly higher. However, this is no reason to get alarmed or panic, because of the fact that most of the cases being reported in these days are of the mild type, and there is no hospitalization required. And even in the rare cases of hospitalization, there is no intensive care or oxygen support being provided. At the same time, people have to take precautions. The authorities have recommended that people wear masks while stepping out, and also ensure that they maintain adequate social distancing and personal hygiene. Particularly in the case of those with comorbidities or pre-existing ailments, it's been suggested that they avoid gatherings in public spaces, particularly those in closed spaces. From Chennai, Siddharth MP, WION World is One.
Meanwhile, the World Health Organization has changed its recommendation for COVID-19 vaccines, suggesting that high-risk populations should receive an additional dose 12 months after their last booster. For more on this, we were earlier joined by Dr. Chandrakant Laharia from New Delhi. Dr. Chandrakant is a consultant physician and an epidemiologist.
What we need to remember that SARS-CoV-2, the virus which caused COVID-19, is around us. And as it happens with all respiratory viruses and illnesses, there are seasonal rise and fall in the cases. So the number of COVID-19 cases in Delhi and in India had gone down to a really low number. The only direction it could have gone is upward. We also need to remember that mere rise in the infection is not the concern. If infection results in the serious disease, moderate to severe illness, then it is a concern. So though the number of cases are rising, number of infection of COVID-19 tested individuals is rising, but we are not seeing the increase in the moderate to severe illness, and the deaths are very much stagnant. So of course, the numbers are rising, which is one parameter, but we should not be looking at numbers only. We should be looking at moderate to severe illness, which is not on the rise, and that is very assuring. This is a rise on the expected line. We never expected that there would not be any rise in the future. And this currently cases are rising. They would fall in the time ahead. In the future also, there would be regular rise and fall in the cases. But this surge would be very smaller in the number. But it's also a time that we should not be looking at the absolute numbers in terms of infection. It is high time that we change our tracking parameter to moderate to severe illness, hospitalization, and deaths. And that if there are change in those, That should be the criteria for any worry. But immediately, as of now, it's not a concern from public health viewpoint.